Number of opioid prescriptions have shot up across Canada over the past 5 years. New figures show, though, that doctors are giving out fewer doses at a time. Last year, 21.5 million opioid prescriptions were dispensed. That's up almost 7% from 2012. The daily doses were down 5%, though. The Canadian Institute for Health Information says most were for chronic pain relief. For more on the implications of these, Hakique Virani is my guest, a specialist, physician in public health and addiction medicine. He's coming to us today from our studios in Edmonton. Good to have you on, Dr. Virani. We appreciate it.
My pleasure.
Can you tell us a little bit more about what this means for the opioid crisis?
Well, I think most importantly, it's that this is a very small part of what's become a public health emergency. Probably 10 years ago, this report might have been more meaningful in that opioid prescribing back then was very much related to opioid drug-related deaths. But now with the illicit drug market such as it is, very dangerous with a lot of toxic bootleg molecules, the prescribing of opioids doesn't relate in the same way to opioid deaths as it might once have.
When we talk about the prescriptions being on the rise, I mean, obviously for some people that looks alarming. What does that actually mean?
Yeah, so, I mean, importantly, the total amount of opioid prescribed in the population has come down while the number of prescriptions written has gone up. So that might indicate that physicians are being thoughtful in terms of how long and how much opioid is prescribed for chronic pain conditions. I think one of the important parts of the report was special consideration for the elderly, who may be more susceptible to adverse events from opioids because of complicating conditions or other complicating medications that may be prescribed to them that require us to be very cautious. But, you know, I think really importantly, we saw that the province with the greatest reduction in the total amount of opioid prescribed was BC, to the tune of almost 12% total opioids prescribed in the population. And yet, by 2017, we were seeing the most shocking increases in the numbers of deaths, which really should be the preoccupation of this public health emergency, is preventing those deaths from opioid drug-related toxicity.
And Dr. Virani, in layman's terms, when we talk about this notion of high-potency pills, the number of high-potency pills being dispensed has gone up. What does that mean?
It's tough to say from this report what exactly that means, but I think what it means is that we continue to have a large part of our population who suffers from chronic pain. And we don't have the luxury of being creative and ambitious about how we manage that chronic pain with things other than medications, mostly because, you know, non-pharmacotherapies are not particularly well covered in most Canadian provinces. So we continue to have to go to the same well with painkiller medications, including opioids, and that requires us to be very, very cautious in managing the risk, mitigating those risks well.
Speaking of that caution, and obviously Canadian doctors coast to coast are following this opioid drug crisis, began in British Columbia, moved on to Alberta, and has now, of course, hit Ontario and Quebec. They are aware this is going on. Has that changed their behavior in terms of what they will prescribe and the potency of the pills and the doses of the pills?
Well, it might have. As you saw, those provinces that saw the greatest decrease in the total amount of opioid prescribed were BC, Alberta, and Ontario. But like I said, those variables between opioid prescribing and opioid-related deaths don't relate in the same way that they would have about 10 years ago, or even 5 years ago, in that the wildcard variable is what's happening in the toxic illicit drug market, where we're seeing bootleg fentanyls and fentanyl analogs that are responsible for the lion's share of the deaths, particularly in provinces like BC and Alberta. That's not to say that opioid prescribing doesn't still play a role. It does. But it's more complicated now than that because we've not done a very good job of managing this public health crisis.
Something else I'm curious about relates to demographics. Canadians 65 years and older were the most often prescribed opioids in this time period. And I'm curious whether you think that is an age group that we should be concerned about when it comes to things such as opioid addiction.
Very much so. I think that, you know, physical dependency to opioids is very, very common. That might not always in the elderly be accompanied by social dysfunction that tends to typify addiction disorders. But we certainly see that in the elderly who are prescribed opioids for long periods of time, you know, they'll describe waking up in the morning feeling horrible until they take their opioid pill. That may be because of a chronic pain condition, but it certainly also has something to do with the dependency that's developed on those opioids and the withdrawal that accompanies that dependency. That's not a population that we typically think of as people who would access the illicit drug market, but we still see opioid deaths in those elderly people, possibly because of other medications that are co-prescribed or other conditions that they might have that make them more vulnerable to opioid toxicity. So yeah, it's a very, very important population for us to consider.
Dr. Hakique Virani joining us from Edmonton. Great to have you on CTV, and thank you for making some time for us today, Doctor. I know it's busy.
You're very welcome.